This lecture is about the empty nest and migration. Before I describe the content of the study, let's think about the topic in general. Question 1. What do these two terms mean, empty nest and migration? Well, we are talking about the migration of children from the parent's home. This leaves the home and the parent's heart empty. This emptiness is known to cause a form of depression called empty nest syndrome. Question 2. How about in your case? Do you live with your family? Do your parents feel empty and depressed? Question 3. When you graduate, will your situation change? Will you move out or move back to your parents' home? Question 4. Think about the Japanese society. Do Japanese people think it is okay to live with parents after graduation or after getting a job? Question 5. What events or situations would make you live with your parents instead of living alone? For example, distance of your job or your parents' house, the health of your parents. Take a moment now to think about these general questions before watching the rest of the lecture. In this lecture, you should understand the who, when, where, and what of the study. You should also identify the most important findings from the study. During the lecture, the key terms will be introduced. You should be able to use these key terms when you discuss this topic. So become familiar with them. Don't forget that you should be able to use all forms of the terms. For example, using the noun migration, such as the migration of children out of the district was encouraged by parents. Or using the verb migrated, such as the children migrated to Bangkok. Let's now look at the study of the empty nest and migration. This study was conducted by Dr. Melaine Abbas. She is from King's College in London. She worked with some Thai university researchers. She published her study in JAMA Psychiatry. This is a journal that specializes in mental health. Depression is one example of a mental health problem. And empty nest syndrome is one type of depression. So her research is looking at mental health in a unique population in Thailand. Her study had two parts. Her first objective was to determine the mental health of Thai parents when their children migrated from the district. The second part, 1 year later, was to determine if moving back to the parent's home affect the parent's mental health. Migration in this study meant moving more than 15 kilometers away. The measured mental health using the Euro-D depression test is a standard method. They ask the parents a number of statements such as, I feel lonely, and ask the parents to respond as agree or disagree with the statement. A score of 6 or more on this test suggests depression. The sample population in this study was around 1,000 households from rural areas of Thailand. Each household had a parent 60 years or older. Some of the parents lived with all or some of their children, and some of them had at least one child who moved out. The location of these households were in villages in the Kanchanaburi province. Seen in the circle here, it's west of Bangkok. This province is about 100 kilometers away from Bangkok, and the transportation from Bangkok to the province takes about 1 day on average. Abbess and her colleagues did 2 surveys and gathered the following information. First, the baseline survey was conducted in 2006. The same survey was conducted 1 year later, in 2007, as follow-up. They asked about the members in the household. For example, 2 parents with 3 children. Next, they asked where each child was living. For example, are they in the house, in the same village, or outside the district? The districts were about 15 kilometers apart. Third, they asked about the support from children. Did the children send money home? Or did they help with the shopping or cooking? Fourth, they asked about the education of the parents and children, as well as the amount of wealth. For example, did they own a refrigerator? Did they own a TV? This was to determine wealth. Fifth, they asked about the social network. Did the children communicate with the parents often, by phone or face-to-face? Did parents talk to neighbors? Etc. Last, they measured the parents' mental and physical abilities. Could the parents think and remember properly? Could they walk and move around? Things like that. They gathered all this information at baseline and follow-up and tried to determine any factors related to depression, specifically migration of the children. Here are the findings. First of all, they determined the migration of the children. They found 84% of the parents had at least one child at home. Compare that to 16% with no children at home. Of the children that left the house, 73% went to Bangkok. The next thing they determined was the characteristics of parents with children who migrated. Parents were usually younger, healthier, still married and working, and had a better education. With all these characteristics considered, parents with all the children gone had a lower risk of depression. Let's look at it closely. At baseline in 2006, 25% of parents were depressed. If we look at children migration, we see that if one or more children still remain in the home, the parents are more depressed at 27%. Compare this to 16% if all the children moved out. The same result was seen at follow-up, but the difference was even greater, 24% compared to 9%. In addition to other characteristics, they found that child migration affected the risk of depression in parents. The last finding was at follow-up. They They looked at the change of children's migration after 1 year. They found 8% moved out, 15% came home, and 77% did not change. What is important here is that when the child moves back, the risk of depression in the parents increased. It was 33% when the child moved back, compared to 23% when the child moved out, and 20% when no change in migration. Many factors could be the reason for the increase of depression. For example, the increased financial burden of children moving back may increase depression, as parents with less wealth and more family members were more likely to be depressed. In conclusion, in contrast to high-income countries, parents in Thailand appear to be mentally better when all the children leave. Therefore, the empty nest syndrome may not apply in rural Thailand. In fact, moving back increases the risk of depression. The researchers present different reasons for these findings. First, parents in Thailand keep in touch regularly with their children, so they maintain a good social network. If they need help, parents have neighbors or other family members that can help. And there is less risk of depression when the children are self-sufficient and can support themselves and their parents. That concludes this lecture. Now we will go on to review the POP post-quiz. Here are the answers to the post-quiz questions. The first 4 questions are just examples. There are many sentences you could make. Questions 5, 6, 7, and 8 are the who, where, when, and what. Please review these answers. And number 9, yes, in the study, parents became more depressed after children moved back to the home. Based on the content of the article and this lecture, you will be expected to discuss the topic of empty nest and migration with your classmates. Here are some what-ifs to think about before the discussion test. Good luck!